Today, I'm going to share a few lifestyle changes that can help people that snore, waiting to get their sleep study done, or people who already have a diagnosis of sleep apnea and are waiting to get on treatment. And I typically share these with my patients while they're waiting for any of these. And the first one that I would start with is the position of sleep. Avoiding the back is one thing that you want to do if you snore or have a diagnosis of sleep apnea. There's something we call position dependent sleep apnea, and that is people that snore more, that have more obstructive events when they lay on their back. So whichever side you choose, it doesn't really matter. The point is that you want to make sure that you're staying off your back. Left or right side is preferred. And I get this a lot. Some people will say, "Oh, I sleep with my belly on the bed." I would still prefer that. Not the best, but I would still prefer that to sleeping on your back. If you sleep on your belly and you can turn your head to the side, that's okay. But as long as you're off the back, that's really what matters. The second position is elevating the head of your bed, and you can do this with if your bed can if your bed has a function that allows elevation of the bed, or you can just add 2 or 3 pillows and elevate your head while you're sleeping. The other thing I talk about is alcohol use close to bedtime will worsen sleep apnea, and it does this by causing relaxation of the upper airway, and that contributes to more obstructive events, more snoring during the night. And if you drink close to bedtime, I want you to let me know in the comment section if you've been told, "Oh my God, that last night you snored so much more than you would have," and that's the reason. The key is to space out, right? Give at least 3 to 4 hours before you go to bed, so that the alcohol wears off your system before you go to bed. Now, the last but not the least is weight loss. And this you will probably work on throughout or for a good number of months while you're on treatment already, right? Because it takes time to lose significant amount of weight. And I always say if you've lost about 10 to 15% of your weight, original weight, that's probably a good time to go get retested for sleep apnea. Um, and again, it's not everyone that obesity is a risk factor for. I talked about that in one of my videos, so you can go back and watch that. And that will be people that have facial anatomy that predisposes them to sleep apnea. So that's all I have for you guys today. I hope this has helped you. Like, share, comment, ask questions if you want to, and I can look at those and see which of them I can answer. I'll see you in my next video. Bye.